Good. Great. Thank you. So here we are, February 4th, 2021. And as Bill mentioned, I am a medical doctor. The CCFP after my name means that my formal training is in family medicine, and the FCFP just means that I've been doing family medicine for almost 20 years. So just means I'm older. And I have been the Director of Clinical Services at InspireHealth for about 5 years now. And my only declaration is to say that I work with InspireHealth. So that's all my bias includes. So I'm going to start, before I dive into stress and managing stress, I'm just going to say a few things about InspireHealth. So it is a non-for-profit charity, and it was founded about coming up on 24 years ago in 1997. And it's been partially funded from by the BC Ministry of Health for that entire time, which we are really, truly grateful for. It is the only model quite like this, with this type of clinical team, funded by the government in Canada. So it's quite unique. We do receive donation support and grant support, and we do have fundraising events during a normal year to help fund the parts of our work that the ministry doesn't fund. So what the ministry focuses on is our clinical team, which I'm going to tell you about. But yes, we have roof over our head, and when we're in person, we serve food in our programs and have exercise equipment, and that comes from our fundraising part. So it's about 2/3 Ministry of Health funding and 1/3 the other funding. We don't have any patient fee, so our services are free to use, both for people with a cancer diagnosis and also for support people to join us for support as well. And no referral is required for our services. And the Vancouver office is the one that has been around for the 24 years. Victoria has had a center for almost 10 years, and Kelowna just behind that at almost 9 years. And then, of course, in the last year particularly, we have a large now virtual center, if you will, or virtual services that have, as I say, really been beefed up over the last year significantly. So we support people with cancer, and that's all types of cancer at all stages of their journey, to what we call play an active role in their care. And that can look very different for different people. That can be, how to get a better night's sleep so that they have more energy during the day. That can be how can they support, improving their appetite. These days, a lot of our support is around mental health and supporting helping people to feel less worried, less anxious, helping people to improve their mood, helping people to get active. That's certainly something that we play a role in for people. So really, what that looks like for somebody is very much dependent on what their goals are and what they would like some support with. And all of our programs use evidence that's out there. So there's evidence in the literature on cancer care and supportive cancer care, and we use that evidence to guide our programming. So it's all about supporting quality of life pieces. So here's our team. As I say, I'm one of the medical doctors, and we all have a background in family medicine from a formal training perspective, and then we have gone on to develop and procure extra training in supportive cancer care. So learning about cancer treatments, learning about side effect management, and learning about lifestyle measures that make a difference in cancer care. Our clinical counselors are all master's level counselors, and mostly that's a master's in clinical psychology. And our exercise therapists are kinesiologists by training, and many of them are also what's called a clinical exercise physiologist, which is a big term. But if you look at some of the information out there about how to get support during cancer from an exercise perspective, they'll often say, speak to an exercise physiologist. So that's what's often the term that's used in that field. And we have registered dietitians that make up our nutrition team. And this is our model, and I won't spend too long on this, but it is so foundational. I had to bring it into our talk today because when we think about looking after, supporting a person who's dealing with cancer, that's the C here, our model really takes into account the importance of some of these directed treatments, whether it's surgery, radiation, chemotherapy in some cases, more than one or all three of these, and all of the other ways that a person can be supported from a whole person perspective. So whether that's nourishing food, movement, sleeping and resting in ways that support the system, mental health support, mind-body practices. Stress reduction, I don't think of as one entity. I kind of think it's woven throughout. We often say that every single program or service that we offer is in the hopes of reducing stress. So it's really woven through the fabric of the care. And certainly this is what we see more and more in our healthcare system, is that broadening of approach, thinking really about that whole person as part of the healthcare that we offer. So this part of the model is also important in thinking about, a person with cancer in this case, feeling really well supported by a team of health professionals who are working together and talking to each other, and that dialogue is going both ways. So the hope is, and I mean, I know that Island Prostate is on this page too, is the hope is that people don't feel alone in this process, and that they feel really well supported. So let's talk about managing stress. And as if it wasn't enough to manage stress during a cancer experience or diagnosis and journey, then we added COVID-19. Well, we didn't, but it added certainly a big layer. And this is a slide that we often showed during sessions before COVID, but it seems particularly relevant now, because many people will say, there are only 2 times I feel stress, day and night. So often it can feel as though stress can follow us through our days and our nights. And sometimes it can feel like there's very little break from it. And that's, well, we're here tonight to talk about whether there are ways to increase the times when we don't feel stressed during the day and the night. So here are some examples of, why COVID-19 has created for many people, such an added layer of stress. When we think about cancer, I mean, I'm probably not saying anything that anyone here hasn't thought of themselves or experienced themselves, but the diagnosis of cancer alone can be a very a significant stress factor. Treatment and all that comes with that, coping with side effects, decision making around treatments, all of those layers and factors can be really significant when you think about stress-inducing features. And then with the COVID-19 situation, we've added potentially increased worry about health, delays in testing and treatment. And I actually participated in a webinar today where they had done this is the Canadian Canadian Cancer Survivors Network, where they had looked at, they did a study in the summer, and they asked people, how has it gone with getting tested, the testing that you needed, getting the treatments that you needed for your cancer. And they asked people, as I say, after the first wave. So they took that survey in the summer, and then they asked them sort of, I guess, in the middle of the second wave. They did the survey again in December. And it was quite significant in the amount of delays that people were experiencing, anywhere in the month to month and a half range, many people having delays that they hadn't even, they didn't even know when they were going to be rescheduled. So this is a significant factor for many people. And another layer is thinking about, our loved ones. And in fact, in that same set of data that was presented today at that webinar, there was a remarkable amount of stress that was shared from the caregiver's perspective about managing and dealing with cancer in the context of this pandemic, and with the delays and with the added concerns and emotional pieces to it. So just really thinking about that, again, that ripple effect of how this impacts everyone around us, particularly our close loved ones. Virtual care has become the norm in many cases. That could be telephone. Telephone is the most common form of care within healthcare, but video conference is sometimes an option. And the fact that that is predominantly the care provided does change and can be a factor of stress for many of us. Work and finances impacted by cancer in many cases. This is a reality for many, and oftentimes for many people, and with COVID-19, there's been an added layer of resource strain for the person with the cancer diagnosis, for their partner, for their loved ones, for their families. Many people have described over my 7.5 years with InspireHealth the emotional landscape of cancer being like a roller coaster, with ups and downs and variations in intensity, but certainly some intensity often described. And I would say very similarly, many people have described this period of this pandemic as a roller coaster as well, with waves and with peaks and with times of maybe less stress or a little bit more room to breathe, so to speak, but then it picks up again, and the on and onness of it, the isolation, the loneliness, boredom, we hear about that, and the worry that can come with this. So as I say, the added layer of the emotions from the conditions that we've all been living in for many months now. So we have heard many times that relationship dynamics often change, or go through a transition or a time of stress through a cancer journey, and we have seen an added on shifting that has happened in many families, not all families, of course, with this COVID situation. So again, not to lay it on too thick here, but yes, it's been quite the year, and it's been quite the year to be navigating cancer and interacting with the healthcare system at a time when there's a lot of concerns, a lot of questions, a lot of uncertainty. Uncertainty definitely should have been a word on that chart there. Here's the thing about stress. So we have a built-in, exquisitely refined system in our body to manage stress. It's called our autonomic nervous system, and we are always using this system. It's not a system that we turn on and off. It's always working, and I often think about it like a teeter-totter, that we are always somewhere in that teeter-totter. And the terminology that's often used that all of us might be familiar with is fight or flight, which is our sympathetic nervous system, symbolized by this saber-toothed tiger here, and rest and digest. Wouldn't you like to be that frog on that lily pad there? So we've got this, as I say, nervous system with two systems working in tandem, like a teeter-totter or a seesaw. Sorry, I don't know the other word for it. Always somewhere along the continuum. And we need both systems. We know that we could probably think of examples of why we need both systems in our body and in our system. And we know that although hopefully none of us will ever encounter a saber-toothed tiger, that stress and situations that bring up fear and that we need to be able to react quickly are part of life. So the dance is always how do we get much more of this frog on a lily pad and minimize the time that we spend in our fight or flight system so that we can get the best functioning of our body, because we know that when we think about our immune system restoring itself like it does, and our digestion working, and our brain getting bathed in the kind of hormones and chemicals that make it possible for us to problem solve and think clearly and lay down memories. All of those things happen when we're in that rest and digest. So it's not just resting and digesting our food that happens in that system. It's lots of other really, really important functions in our body. So what we know is that prolonged states of that fight or flight state, or fight or flight or freeze, which is often described. Some people do tend to be more, freezers when things get stressful. We know that it has impacts, and some of the impacts that probably come to mind most readily for people are some of the impacts that affects our mind and our mood. So I'll read off a few here. Many people will describe, if they're enduring stress and higher levels of stress over a longer period of time, that they will become more impatient, have a shorter fuse. Feeling of being overwhelmed. This is often described when we're kind of in that fight or flight mode, or the pedal to the metal, as it's sometimes described. The emotional roller coaster. So it's not to say that, if we're having a lot of emotions, we're in the middle of a stress response, but we might well be. And it is something to think about. How do I, get off the roller coaster? Memory issues. I mentioned that, it's in rest and digest that we lay down memories, but sometimes people will say, ever since I got this cancer diagnosis, I can't seem to remember anything. I need lists for everything, or I'm losing my keys, or I'm having trouble even, remembering why I'm at the grocery store, what I'm there to get. So that we often attribute that to having a significant stress response going on for people. Procrastination. Some people's manifestation of stress is in that area. It's quite something I relate to. Anxiety is a common manifestation of a stress response. Low mood and depression. And for some people, the way that they often sort of protect themselves or try to respond to stress is to withdraw and isolate, which we know can make things even more challenging. So again, not the only reason why you can have those things taking place. Obviously, there are other things at play in many cases, but something to think about for sure. The parts of stress that maybe we don't talk about as much and are not as maybe commonly thought of tend to be some of the physical effects, because we often articulate stress as sort of more of an emotional process, but there are many physical impacts of a prolonged stress response. increased blood pressure. Again, not the only reason why your blood pressure might be elevated, but certainly stress and prolonged stress plays a role in blood pressure. Aches and pains. This is actually a really common one that doesn't always get connected to stress. Changes in the way our gut is functioning, and we can appreciate that, if we're spending less time in rest and digest, that we might have troubles with things like indigestion, diarrhea, fullness, what we call dyspepsia, which is when you have pain after eating often. Appetite changes are really common. For some of us, that ends up being a decrease. For others, it ends up being an increase, which can contribute in part to weight change. Sexual dysfunction can be a physical impact of stress, and fatigue is very common. Sleep problems like insomnia or trouble staying asleep, so you get to sleep, that's called middle insomnia. But you can't stay asleep. I should have finished my sentence there. And more frequent infections can be a physical impact of prolonged stress as well, or difficulty healing infections. So again, not to attribute all these things automatically to stress. Certainly it's very important to discuss with a medical professional, but just to say that this is a kind of the aspects of stress that we don't talk about as much. And we can see why over time, if things are impacting our body on this emotional level and on this physical level, that we can see that, there are going to be ramifications for not only how we're feeling, but how our system is functioning. So let's talk about some coping strategies to take care of ourselves. And we often say to take care of ourselves in mind, body, and spirit, thinking about, kind of all the components of being a human being. So first, we're going to talk a little bit about how the mind works. And I am going to use this imagery to see if you'd like to participate, you can follow along, because it might give you actually a felt experience of what I'm talking about. So if you'd like to follow, let's imagine, and you can look at the picture on the screen here for inspiration if you'd like, and just sort of see if you can drift into the forest with me. So you're by yourself, and you're feeling, fortunate to be in this lovely forest. You're doing a nature walk, and it's a beautiful sunny day. So see if you can take yourself here. It's a beautiful day. The sun rays are coming through the trees. You can feel them on your skin. You can hear the chirping of the birds, the crackling of the sticks and roots underneath your feet. Maybe you hear a woodpecker. And you're seeing the beautiful greens of the ferns and the leaves of the trees. You see the sun's rays glistening on the leaves. And there you are. You're one with nature, comfortable, peaceful, walking in the woods. A meditative walk. So, suddenly, there's a loud noise nearby. Try to stay in the moment here. You don't know what it is. There's rustling in the bush nearby. And all of a sudden, you remember very recently, the last couple of days, a neighbor was talking about a bear sighting in this area. Okay, so what are some of the physical sensations that might be happening in your body? Maybe your heart's pounding. Maybe your breathing has changed. Maybe your muscles are tensing up. Maybe you've frozen in the spot. So these are really common responses that our body has to stress. And it's important to say, as we take ourselves out of that woods, that we need to have these responses. And that's what I said, like this is an important part of our system, because by chance that is something, we need to be ready to, move into action to be safe and from a survival perspective. So the challenge is that whilst we need that, oftentimes our body can put us into that state that, you might have been dropped into when you, when I said, there's a loud noise and maybe it's a bear. We can be put into that state, in situations of danger, but also in situations of perceived danger. And oftentimes our body can put us there even when there's no real danger, but we're just thinking about something stressful, something that brings up fear. So unfortunately, our body's not able to decipher the difference, and we can experience the full manifestation of stress with just our mind alone, with just our imaginations and our being triggered by memories or brought to a stressful place by our thoughts. So the challenge is that oftentimes we do this on a regular basis. And it's not to say I'm not blaming any of us, but we can get into quite a pattern around spending a lot of time thinking and experiencing stressful thoughts or stressful circumstances. And when we are in that state, it's hard to appreciate anything else. It pushes out and it clouds out and it takes over everything else. So, as an example of that, once we were in potentially it's a bear mode with that imagery that we just did anybody hear the birds chirping anymore? Did anybody feel the sun on their face? No, right? Quite likely we have left all that behind and we're now in the middle of the stress response. So that is the challenge, is that we can end up spending a lot of our time in the stress response, and it can end up taking over a lot of our lived experience. And it has health consequences for sure. And I think I've mentioned those already. So another thing to know about the mind is that if I show you this picture and I say to you, don't think of an orange balloon. Don't think about it. Don't think about orange balloons. And you close your eyes, what are you thinking about? What are you seeing? What are you thinking about? For most of you, probably you're thinking about an orange balloon. Here's the thing. Our mind doesn't process these kinds of directions. We have a negativity bias, and we have a bias to focus on whatever's in front of us. So, and similarly, if we, have a tendency to kind of talk to ourselves in terms of, you shouldn't feel so stressed, or don't worry. What ends up happening for most of us is we actually feel more stressed and we worry. So one of the things that we encourage as part of sort of working with the way that our mind works is a reframing. So one of the things that we could do is, instead of saying what we don't want to feel or what we don't want to be, don't be stressed, shifting that to I will feel more relaxed, or I am at peace, or I want to feel peaceful. Using terms that allow us to focus on and gravitate towards the states of mind and being that we want to move towards. And in this way, we can be very thoughtful and intentional, and we can shift what we're focusing on. So this is important when it comes to day-to-day, because truly, the voice that we speak to ourselves, nobody speaks to ourselves more than ourselves. That's another way to say it. And it's important to know that we spend all of our days and all of our hours with ourselves. So the ways that we talk to ourselves is really important. And when it comes to COVID-19, we've had, I guess now, what, 10, almost 11 months of practice with this. But one of the things that again and again, when we look at the studies around stress reduction during COVID and managing mental health during COVID, this piece keeps coming up, is that the more that we can be very discerning about how much information we take in and the source of the information we take in, and balancing that sort of information gathering and data collection and research that we do with time away from that, time away from screens or media or news, to get ourselves in a different state of mind and frame of mind. That balance is so important, because similar to, the potential for a bear in the woods, sometimes reading some of the things that we can get our hands on these days, and my goodness, can be a rabbit hole of, one thing leading to another, online, for example. Some of those things put us right in the middle of a stress response, and so awareness about that and setting boundaries for ourselves, or maybe it's putting ourselves on like a bit of a media diet, or saying I'm going to check the news 3 times a week instead of every day, or it's going to be different for each of us, but really being discerning about how much information we're taking in and how we're getting it as well. Sometimes people have said, I've stopped watching it, I only read things, and that's made a big difference for my mental health. Also thinking about when, because we know that when we're more tired, we're more likely to not only have a stress response that happens for us, but also get kind of stuck in it. So we know evenings are a vulnerable time, especially later on in the evenings, and then it can impair our sleep, because when we get that big flood of hormones in a stress response, it takes hours for those hormones to be kind of sopped up again. Sorry, that's my medical terminology, sopped up, meaning the body has to reabsorb them all. They're traveling all around the body, and the body has to go and kind of collect them all up and get them out of our bloodstream, and that takes time. So if we're doing that, say before we're going to sleep, and we're getting into quite a state, it can really impair our night's sleep, which again, one of the best things we can do for our stress is getting more sleep and really prioritizing a good sleep routine. So all of these things are connected, truly. Another way to work with the mind is to think about how sometimes we make a generalized statement, and we kind of paint the whole situation with, as they say, one color paint, or, we become, I think that the terminology that's often used is like black and white thinking. So, and certainly I think we've all been there, but we can have the feeling that we don't have any control. We can have a feeling like, I don't have much control. I got cancer, and that was out of my control. And now, with COVID-19, things feel very out of control. And that can be an incredibly stressful experience to feel like there's no control. And oftentimes we want to go from that to feeling in control. And just jump from one to the other. And although sometimes that's possible, often we struggle to do that. And I think one of the reasons why is because we have a tendency to, and this is true of most of us, obviously, no, we're not all exactly the same. We're all a bit different when it comes to this. But for many of us, we struggle with the first step that is so important to any sort of reframing process, and that is validation. Because as long as we're kind of in a mindset of either blame for our feelings, or we're feeling guilty for feeling that way, and we haven't sort of allowed ourselves to feel how we feel, whether that's scared or fearful or worried or angry. The challenge is it's hard to move on when we haven't admitted, we haven't allowed ourselves to feel these things. We're trying to jump a really important step. So validating our emotions, and in this case, I use the example of saying, yes, there are a lot of things about this situation that are out of my control. But it might be, yes, I feel angry about this cancer diagnosis, or I feel scared about COVID. It's a really important step to validate our emotions. And I think sometimes we do try to skip this step. It can be uncomfortable to experience emotions. When we validate, we often actually have a fuller experience of the emotion. So, I think it can be tempting to skip that or to want to skip that. Why would I want to feel more sad if I'm validating my feelings? But the thing is it's the way through. So the hope is not that you're going to stay there, but that by validating it, you're going to be able to move through it. And then we can give ourselves space for that. That might take some time, but then we can often move to, and the key is to try to do this without a lot of judgment for ourselves, which is there's a big practice here, but is to say, is there more gray here? Rather than no control, are there things that I do have some control over in this situation that seems quite dire? And again, it's hard to, it does take a lot of practice to really work through this in a way that we don't have a lot of, well, you should do this, and well, you could have done that, and have those judgments come up. But the more we practice this, the better we get at walking through these scenarios with ourselves without the judgment, the inner critic coming in as much. Although I was listening to an interview with Sharon Salzberg the other day, who's a she founded a mindfulness institute. She's considered one of the foremost people that brought mindfulness from the East to the West. I mean, she has done a lot of mindfulness probably every single day of her life, and still she describes that her inner critic comes out and talks to her on a regular basis. So there you go. We all have it. So it is a practice, and every time we practice it, we get better at it. So one of the things that we could say is that we do have control over how we spend our time and who we spend it with, in the sense of, who are we interacting with online? Who are we connecting with over Zoom? So, thinking about the grays rather than the black and whites. And I mean that in very positive way, wearing something gray myself right here. So, okay. So another thing to think about is just going to here. Think about how we fill our tank, or as I put here, fueling our reservoirs. I hope nobody will mind being compared to a reservoir, but you know, in a lot of ways, our body does respond and function like this, where you know we have inputs. And we have resources, inputs of you know resources being put in, and we have resources being used up, and there has to be a balance of in and out. And oftentimes, especially when you know we're dealing with a new diagnosis, or you know at times of higher stress or strain, we can have you know a lot more going out than coming in, and so we can be functioning you know quite near the bottom of our reserves, and this can add strain because we know that this in and out process is not as effective or as comfortable, or as healthy when you're getting down right to the bottom of your tank, and things are feeling you know quite drained, with very little buffer. So we like our reservoir to have a reservoir to have a buffer, and you know many things contribute to this, but a lot of them that we talk about in our programming are you know things like sleep really buffers our reservoir, mindfulness practices, which I don't think we're going to have time to do today, but we often say, you know, even a few deep breaths can bring us into the present moment, which is truly where all the good things happen. And you know, whether it's doing an exercise, I think I had said this last time when I talked to this group. I know there are new people here this evening, but this exercise of using your hand and you know breathing in, inhale and exhale, and then just doing five deep breaths. Inhale up one side of the hand, exhale, inhale, exhale, and at the end of that you've had 5 fuller, they don't have to be you know deep breaths that leave you feeling winded or anything like that, but it's a nice tool to remind you that you know here in the palm of your or not palm, in your hand or in the center of your lap, you have a tool to remind you to do some nice full breaths. So breathing practices can make a huge difference and can be effective truly, you know, in 2 minutes, 3 minutes, 4 minutes. We can see of a breathing practice, we can see the levels of one of the stress hormones called cortisol. We can see decreased levels of it in saliva tests, where you take a test from the inside of your cheek there. It's really quite remarkable. So let's think about ways that we fuel our reservoirs. Time in nature. If you know a mindfulness practice sounds like something where you're as we call the monkey mind will just start running away with you, then you know maybe starting with a walking meditation. Many people find that's a nice place to start when it comes to you know practicing getting into that rest and digest mode, which really does it's there's nothing fancy about this, and there's no wrong way to do this. It's about paying attention on purpose to either our breath, to another sensation in our body. Sometimes people find, the sensation of their hands on their lap is something that they can use as an anchor, but it's paying attention on purpose in the present moment, and that's the only requirement. So there's so many ways to do a mindful practice or to do meditation, that there's something for everyone to discover in this realm. So this is a slide to remind me to mention an area that many people find is incredibly nourishing from a reducing stress perspective, and improving well-being perspective, and that is something that's in that realm of nourishing. Some people will call it their spiritual side, their soul, their essence. Some people will say, spiritual doesn't really work for me, but when I know that when I go out into nature, I connect with a deeper sense of peace, or I connect to Mother Earth, or to the fresh air, and I feel filled up in a different way. So some people, their connection that's strongest for them is with a pet that really, or an animal that really connects them to this essential piece of nourishment. So thinking about ways that you nourish your spirit, I'm going to use that term to mean all of the above that I just mentioned, and looking to how to do that daily, because things that we that we end up having to do every day, like eating, are incredibly important, and as important is nourishing, our other aspects to our humanness, like our spirits. So, and I wanted to share a fairly recent study that was done. I'm just going to move my hair thing around. Sorry, there it is there. Okay, perfect. So we found this study, and we thought that it seemed particularly relevant for this conversation and this work that we do. This was an 8-week study where participants were asked, sorry, it's quite a busy slide, but just focus on the left-hand side here, where participants were asked to spend 10 minutes or more, at least 3 times a week, in a nature setting. And in order so that they could compare people to each other, they asked people to be not to be exercising or talking or using electronic devices. So they were sitting, I guess they could be lying down, but I think most people end up being sitting in daylight, in nature, and the minimum was 10 minutes, but many stayed for longer. And then they did saliva testing, and they looked at a couple of biomarkers for stress, specifically the one that I mentioned recently, the cortisol, and also another stress hormone called alpha amylase. And what they found was that for everyone, there was a benefit for this time in nature. And the benefit peaked at about 20 minutes. After that, the benefit continued, but at a less of a it was less prominent, but it did continue up until 30 minutes, and then it sort of stabilized and plateaued at 30 minutes. So 20 to 30 minutes in nature decreased the stress hormones in these people quite significantly. And how incredible. I mean, these were people, they were sitting in nature. They were whether it was on a bench or on a cloth in the woods, but they all had similar results in the sense that it was improved their stress hormone levels after only 20 minutes. So we can all do this. And we live in a wonderful place for it. So I'll just spend the last couple of minutes speaking about some of our services at InspireHealth. Should you want to connect with us, I know that there are many amazing services that you have access to through Island Prostate. So the idea would be that, you know, if there was anything that we could be of additional support, you can connect with us. And as I mentioned, all of our services currently are over the telephone or over a video conference. And we have a great website. Hopefully it's very easy to use, but of course we're also available by telephone or by email. You can, if you'd like to, sit down one-on-one with one of the medical doctors, and we do have an hour and a half when we first sit down with you to walk through whatever you'd like to walk through. Sometimes we're helping people make decisions about their treatment path, better understand the options that they're being offered. We do, you know, a lot of mental health support, a lot of lifestyle support or lifestyle management. So those are some of them. Oh, sleep support. We end up talking a lot about sleep with people. We also have counselors who can do a course of short-term counseling, and so, you know, that's an opportunity, an open opportunity for anyone. We do a lot of online classes per week. In fact, I was trying to figure out how to show you what we do, but it was just there's so many classes in the run of a week that I couldn't get them all onto one page. But we have themed support groups that we call Inspired Conversations. So these might have themes like self-compassion or intro to mindfulness or dealing with grief and loss. And there's no pressure or requirement to speak in these sessions. Many people, you know, join, you know, only as an observer or a participant, but there's no pressure to you know, to speak or to engage. You can just be there to soak up the material. And many of our workshops are experiential. So, and we have a lot of you know, art therapy options as well, because we have 2 art therapists on our team. We have 3 online meditation classes per week, and these are different types of meditation, different styles of meditation, but the idea is to provide a starting place for people who are just getting started with meditation. And we also have once a month a support group. We talk about self-care for the support person and how to support yourself through this process as well. We also have a team of dietitians to help support around finding your way to nourishing food choices. So you can spend time one-on-one, or we have some workshops and some online cooking classes as well. And that's what I just put there. Recipes on our website. I'll just go a little bit more quickly. I know it's right at 8 now. And just to say that I think through Island Prostate, I know there's lots of support for exercise and how important exercise is. It's incredible the difference it can make for people to move their body in ways that feel safe for them and that are the right pace and the right intensity for them. We know that we've seen it do incredible things for mental health, decrease fatigue, improve quality of life, improve physical function. So if this is an area that we could be of support, we're here for this. We do have many exercise classes per week that are available, and things like yoga and qigong. So if you've never checked out qigong, please come and check it out with us. So that's just what that says. And I'm going to skip that because it's maybe a bit, well, anyway, we look through the research and we produce something called research updates. And so this is something that you could get in your email inbox once a month if you like. and many classes to participate in if you'd like. And we're here. So I think maybe I'll stop there. It's available to you if you'd like. And that is that's the Oak Bay Clinic that I'm in right now. But we're obviously available over the telephone and online as well. So I am going to stop share here.